The potential risks associated with any procedure, and in particular interventional radiology procedures, are really related to where we place our devices and how we access the body. So when we access the body through a small needle, which is the same size needle we actually use to draw blood. But anytime you access an artery or a blood vessel, there's always a risk of bleeding or injury to that blood vessel. But these are very rare risks, and they're also treatable risks, so they may not leave a permanent sequelae. The other risks really deal with the medications that we may be giving the patient with respect to sedation. So patients can rarely have an allergic reaction, but again, we're talking about very insignificant or low risk type events, and they're also rare. So in the setting of giving medications, for example, for sedation, an allergic reaction may occur less than 1 in 15 or less than 1 in 20,000 patients. They're also treatable. The last risk that you should know about related to interventional procedures is that the device we deliver to slow the blood flow down to the prostate is a little microsphere. And if you can imagine a small little round piece of jello that's really very tiny, or a small grain of sand, we deliver that into the blood vessels of the prostate. And all of those little grains of sand are intended to go into the prostate. But in some rare conditions, a patient may have a connection between that blood vessel and other blood vessels in the pelvis. And those small little grains of sand could travel at the time of the procedure to those other areas. And it could cause a temporary inflammation or response in that other site. Again, it's a rare complication, but something to know about even in minimally invasive procedures. That being said, interventional radiology as a whole, even considering these risks are far less than other surgical or minimally invasive treatments that are on the market.